Hello, everyone, and welcome to this installment of Healthcare Settings, Claim Cycle, and Claims Processing. I'm Ms. Blair, and again, I will guide us through this lecture on healthcare insurance. So, this time, we are going to talk about ICD-10 CM coding. Well, what is ICD? ICD stands for International Classification of Diseases. 10 is the 10th edition, and we're going to deal with the PCS in a little while. So, I got a few expectations that I want you to go away with. Okay, I want you to relax. Okay, we are not learning the code just yet. We are just getting an introduction. Okay, just an introduction. There's a few classes you got to take before you learn how to code. I'm going to introduce you to what I call the 5 W's and the 1 8 of coding. If you can remember those things, you are way ahead of the game when you get ready to code. I'm going to give you a history of WHO and ICD, and we expect that at the end of this lecture, you'll know some things. We're going to expect that you're going to have a basic idea of what ICD-10 PCS is and the use of ICD-10 CM. We expect that you're going to understand some key terms relating to the ICD-10 CM coding, okay? Some expectations surrounding computer assisted coding. Doesn't that sound good? Computer assisted. And some expectations concerning some understanding of coding when it comes to illnesses, injuries, diseases, and conditions. And guess what those are? Those are diagnoses. So that's what we're learning about today. So in our agenda, it's going to be the same thing. We're going to review ICD-10, ICD. We'll start off with ICD, and then ICD-10 CM, PCS. The key terms, we're going to actually define what is computer assisted coding. Um, we are going to real quick go over medical necessity. I think you already know what that is. And then we're going to take a look at what are illnesses, what are injuries, what are conditions, what are diseases. And we need to know what those are because those are diagnoses. So let's take a look at the history of ICD. Now, the World Health Organization, which we call WHO, they have been around since 1947, and they partner with the United Nations, and they work to promote public health issues around the world with all different types of countries, organizations, and they are founded on the principle that everyone, everywhere has a human right to health care. And everybody, you and I included, should enjoy the highest standard of health. And we know that that does not exist everywhere in the world. But the WHO is working on that. They've been working on it since 1947. And so, in order for that to happen, they needed a way to classify different things and get statistics. And so they put together the ICD-10, International Classification of Diseases, 10th edition. We're now at the 10th edition. And they classify mortality. And mortality has to do with death. And they get that data from death certificates all around the world. And so they use that information and they say, okay, statistics on in this particular country, country A, in 2019, we had X number of people who died from lung cancer. And from that number of people, X number were men and X number were women. And then from that number of women, this number were under 21, and this number was up to 50. And so they have all these different statistics that they can use, and they try to figure out what is going on with by using these statistics. And for example, they also use them for public health issues. One thing we know is that the mortality rate, the death rate of African American newborns is still too high in the United States, especially for a developed country, as we call it. So they work with different organizations to see what they can do to bring that down. And so they share and they compare the information and they keep track. And they say, okay, what factors could influence this health status? Is it socioeconomic? Is it the environment in which person lives? Is it because they don't have good access to health care? All of these different things they look into, and once they find a correlation, then that's what they can work on, or they can ask another organization or a government to work on, and they can give them the information. Okay, so for a very long time, years and years and years, we had ICD-9 that we used to code, okay? ICD-9 gave us about 13,000 alpha codes. When ICD-10 came along, and then the clinical modification that's only used in the United States, we're up to now about 72,000 possible codes. Now we say possible. That means that we put all the different codes together based on guidelines and the possible way that you can put them together based on category and subcategory. We can come up with 73,000 codes. A lot of codes. Don't ever say you want to remember or all the particular codes. I want to remember. Never. You will never learn them all. What you have to do is you have to learn how to use all of your manuals, how to learn how to read all of your guidelines and understand them. You have to learn how to read the medical records. You have to understand medical terminology, and you take all of that information, you put it all together, and you can determine the diagnosis code for any condition, illness, injury, or disease that's out there. Okay, so you don't have to remember anything. You don't have to memorize. You never will. That's not our job. Our job is to code. It's not to memorize. So in the United States, we use ICD-10 to classify morbidity. Morbidity is disease. Mortality is death. Okay. We use it on diagnosis for all settings: outpatient, inpatient, clinic, ambulatory surgery centers, all of those particular type of things. We'll get more into settings as we move forward. I know every time we have a lecture, I say we'll learn more, but we will. Okay. ICD-10 PCS was created by CMS, if you remember, Centers for Medicare and Medicaid Services, and it's only for inpatient procedures. Okay. So let's look at PCS. It's for inpatient procedures. So even if we have a clinic or ambulatory surgery center, and it's attached to a hospital, and the patients are inpatients, so they're not staying overnight, they're not an inpatient. We're not even going to go into observation services and all that type of thing. We would use CPT codes. Those are outpatient codes. Okay. PCS codes are very, very specific. They're very, very fun as far as I'm concerned. They are 7 digits always 7 digits. They are alphanumeric. You see an example on the screen. OHQEXZZ, and every single one of those characters in each position has a very specific meaning and a very specific criteria. And in our example, the O in the first position means it's in the med surge section of the manual. I'm sorry, medical surgery section of the manual. The H in the second position means the body system, GI, could be GI, right? The third is the operation, okay? Now, it doesn't mean what operation did they have. It means what had to happen to the patient. What happened? So in this instance, this third operation, we're using drainage as an example. In our example, right, we use skin laceration or a suture of a skin laceration left lower arm. But I wanted to show you what each particular section or each particular criteria for each character meant. And once you change a letter, you will change what the position means. So I'm going to go over that one more time. 7 alphanumeric characters. Each position has a very specific meaning and criteria. The first character is a section of the manual you work in. The second is the body system. It is always the body system. The third is the operation. The fourth, the fifth, the sixth, and the seventh have very specific meanings, and it's even more specific than we have here. And so I didn't think it was necessary to go further into that. Okay, so ICD 10CM, all right, in the US, it's required by HIPAA. Coders, you are future coders. A lot of you are. A lot of you are in HCA. A lot of you may be in the Still have to know that coders use documentation in the medical records to select the appropriate codes. Okay? The diagnosis is in my 5 W's, and I call it the why. Why did the patient have the service? Basically, what's wrong with them? But it's not the what, it's the why. The who is the patient, the what is the procedure, and is when did it happen. So it's the date, the specific date. Remember, dates change, days change at midnight. So today is Monday at 12:01 a.m. The day changes to Tuesday, and the date changes. Okay? Place of service: hospital, nursing home, office visit, clinic. The why, diagnosis, and how is the approach. So if we're having surgery, was it laparoscopic, meaning they didn't have to choose to cut the patient with very long incision. They had very small incision, used the laparoscope, went in, basically the camera, looked around, and was able to do the surgery. Third-party payers, remember this, you HCAers. Third-party payers use the CM codes to determine the coverage of the services that the physician or the provider render. So it's not so much reimbursement, it's coverage, okay? So when they get a claim goes through ethics, And the diagnosis says provider did service A, and it was because of um, the patient needed to lose weight. Well, the provider coverage can say we don't pay for anything dealing with weight loss. Right then and there, that claim is denied. It's denied because it's the coverage of the service. Okay? And then once again, ICD-10 codes are used to establish medical necessity, which means that the service was necessary in order to diagnose and treat the patient. Nothing should ever be done medically that isn't necessary for treatment or to diagnose a patient. So before a coder can learn how to code, they have to learn how to use a manual. And I hate to say it that way, but you have to learn how to use it. It's divided into sections, such as the alphabetic index, neoplasm table. One thing I want everyone to understand, a neoplasm is just a tumor. A tumor is not automatically cancerous, it's just a tumor. A cancerous tumor is one that is growing out of control. You can't code it as cancer until someone or a professional clinician says it's cancerous, or you get a cancerous diagnosis. Okay? So now we have a code structure. It's alphanumeric. You don't have to go into the very specifics because you're not going to code. But it's an example of what your code is going to look like. It's from 3 to 7 digits. In order to code diagnoses, you must understand guidelines. And guidelines tell you how to apply a code and how to use it against the diagnosis as well as the documentation. So in this instance, it says, okay, well, if you have a condition that's described as both acute, which means it came on suddenly, bam, okay, like a acute bronchitis. It just came on, bam, yesterday. The patient started having the coughing and the wheezing and things like that. And it's also described in the manual as chronic, meaning that this person gets it over and over. They have it every 3 months, they have bronchitis. If in the manual there's a code, or in the index there's a code for both the acute condition and the chronic condition, we must code both. And we have to put the acute code first. Now, if we don't code it that way, it is wrong. We will get our claim denied. It will come back, and we have just lost money. That means we have to know these guidelines. And I just put the reference to the guidelines. Okay, as you can see, the guidelines are 121 pages. That's why I'm saying relax, you're not coding it. But in order to code properly, I have to know that. Or I have to know it's out there because I've at least read it and it rings a bell when I get ready to code. Okay? Here are some key terms. The alphabetic index. Let's call it like a table of contents. The diagnoses are in alpha order, and then by body part, you go to it, you look up your diagnosis, it gives you suggested codes, and then you have to do something else with it, and we'll get to that. A diagnosis is a condition, it's an injury, it's an illness, it's a disease. Those four things are different. The eponym, you may hear this, it's a disease or syndrome named for a person. For example, Lou Gehrig's disease. Lou Gehrig was a famous baseball player, and they named the disease he had after him. An external cause. What caused the patient to get injured? What caused the patient to get a broken leg? He fell off the ladder. You have to code that he fell off the ladder if you know what caused him to get injured. We talked about neoplasm. Querying a physician. Well, if I'm the coder and I'm reading the documentation and I don't think I have enough in order to code correctly and to the highest level of specificity, then I have to ask for additional information from the provider. And that's what's called querying. And it's basically asking. It's just a fancy term for asking. And a tabular list is where your codes are in numerical order. Once you find codes in the alpha index, then you go to the tabular index and you verify your code. Computer assisted code. Woo, yay, everybody clap. Out in the real world industry, there's computer assisted coding, which is probably built into the clinical management system, part of the EHRs, which are electronic health records. So you would start clicking on what your diagnosis is, a particular codes, and you would just go through a different set of menus, and then it will give you some suggestions. You make your determination, and it's put into your plan. You don't have to look in manuals, paper manuals, like you will do while you are here at UMA, but you will know how to find your codes, okay? And that's very important. Okay, let's look at some diagnoses. A disease, osteoarthritis of the hip. The joint has ground itself down. It needs to be replaced. That's when you get a hip replacement. Your hip joint is actually in your groin. Gallstones is a condition. Normally, you probably get your gallbladder taken out. And once you get your gallbladder taken out, you probably won't have gallstones anymore. An ankle fracture is an injury. Okay, it was caused by something. Well, it could be traumatic. So if you could see, there's two bones down by the ankle, your fibula and your tibia, sorry, and those bones break down by your ankle area, ankle joint, sort of ankle fracture. It's very painful. I've had those happen to me before. But these are what you can consider diagnoses, but in the different criteria of a disease, a condition, or an injury. So I think it's way past wrap up time. All right, so information from today's lecture is also in chapter 6. It's available for review. Make sure you listen or read the textbook information before you do any of your work. I'm available. Academic services available. Tech support is available. I thank you for your attention today. And I will see you next time as we continue with our healthcare studies, claim cycle, and claims processing. I'll see you next time.